Did you know that scoliosis is a much bigger and more common healthcare problem in adults compared to adolescents or teenagers? Hey, Dr. Chris Gubbels here from ScoliCare Denver, and today I want to talk to you about how to determine the best and most appropriate treatments for adults with scoliosis. You see, a lot of people think about scoliosis when we think about teenagers, and the reality is it's only about 3% of teenagers ever get diagnosed with scoliosis. But when we look at adults over 60, some studies show that up to 68% of adults actually have or develop scoliosis. So scoliosis is a much bigger problem or much more common problem in adults when we look at scoliosis. And a lot of times in adults, especially as we age, scoliosis can become very painful and it can dramatically impact the quality of someone's life. So today I want to go over 4 different areas that you need to consider when you're thinking about scoliosis treatment in adults, and to help you determine what the best treatments may be if you're an adult with scoliosis, or if you know someone, a family member or friend that is an adult that's suffering from scoliosis, and especially if that scoliosis has been shown to be worsening. So first of all, what exactly is scoliosis? Scoliosis is defined by having a lateral bending of at least 10 degrees with rotation. Now, there's 2 different types of scoliosis when we look at adults. The first is someone that is an adult that has a scoliosis that they had when they were adolescent that's still present in adulthood. And that scoliosis frequently will start to progress and break down and get more severe, more painful in adulthood. The second type of scoliosis that can be found in adults is called a de novo scoliosis, which means a new scoliosis that develops in adulthood. And this is also a degenerative scoliosis, and a de novo scoliosis is generally more progressive or progresses faster in adults. Now, there's some other scoliosis that you can have in adult if you have a secondary scoliosis, meaning a scoliosis that was secondary to a condition like possibly Marfan's, or a potential neurological scoliosis, like for someone that has cerebral palsy or something like that. But the 2 biggest ones in adults we're talking about are adults with an idiopathic scoliosis that was present in adolescence and still have as an adult, or a de novo scoliosis, a new scoliosis that actually develops in adulthood. Now, there's different signs and symptoms that are frequently present in adults, and typically pain is the motivating factor or the driving factor for that adults actually seek out treatment for scoliosis. And pain for scoliosis is a little bit different than pain that someone that has back pain that does not have scoliosis. For example, if you do not have scoliosis and you have back pain, generally that pain is more centralized. Compared to someone that has scoliosis, the pain is typically on the side of the scoliosis. It's more asymmetrical. Also, someone with low back pain without scoliosis a lot of times gets sciatic pain, or that pain going on the back of the leg. And someone that has a scoliosis, like a lumbar scoliosis, a lot of times gets pain down the side of the front of their thigh because the nerves are impacted a little bit higher in the spine. Also, when adults get scoliosis and have pain, a lot of times that pain is worse when they've been standing or sitting for an extended period of time. And sometimes when they get up and they do things like walking, that pain can progress. And the pain for adults with scoliosis a lot of times really starts to interfere with their quality of life. A lot of adults will report that doing things like walking around the block, going for walks gets much more challenging. It gets hard to do physical tasks like gardening, things where they're bending over. And so it really starts to impact quality of life. Now, a couple other things you want to look for someone with scoliosis is some visible signs. You may have an obvious curve that's present. You may notice some obvious rib humping. But a lot of times what we also see in adults is they start to get a postural collapse, where they'll start to shift or collapse to one side, and they start to get a forward hunch or lean. And this happens as the curves progress and degenerate and get worse, a lot of times later in adulthood. But we can also start to see those develop when people are younger, and we can prevent those from happening if we get the right treatment at the right time. So in order to get the right treatment, we need to do a proper evaluation. So if you have scoliosis, or you know someone that has, you need to get someone that actually specializes in treating scoliosis. General practitioners, most chiropractors, physical therapists, medical doctors, even pain management or surgeons are frequently very unaware of how to do or how to recommend the most appropriate non-surgical treatment options for scoliosis. And when we do an initial exam, there's a few things we're going to look at. One, we have to have new x-rays, typically full spine x-rays from both the front and the side is where we want to start. That allows us to measure the severity of the curve. It also helps us determine if there's breakdown and decay and degeneration. We can determine if there's some instability in the spine, and there's other things we can look for, such as a leg length and discrepancy or a short leg on one side that helps us predict the likelihood of a curve progressing. So when we do the x-rays, that's the gold standard. We can measure how severe the curve is. Plus there's a lot of other things to look for to determine the likelihood of a curve progressing. physically, we want to look at posture. We want to look at his upper back and neck centered over their pelvis, or are they hunching to one side? When we look at someone from the side, are they really hunching over? So we're going to look at posture. Then you got to do a thorough physical and neurological exam to look for other neurological problems or other physical problems, things that could be going on. And you want to do a functional analysis to determine how is it functionally starting to affect him? How is it affecting someone's ability to go from sitting to standing and walking? Those kind of things. How is it affecting their balance? Because that can help us determine the likelihood of other injuries like risk of fall, but also what treatments that are going to be the most appropriate for that individual. And the last thing we need to look at, what are the best treatments? Now, things like chiropractic, physical therapy, yoga, massage, Pilates, all that stuff can be really good for your overall health. It can help reduce the pain. So a lot of times it can be recommended for someone with scoliosis, but unfortunately, those things have not been shown effective at reducing the size of the curve or slowing their progression. There are some treatments that have. And generally for an adult with scoliosis, the treatment options are 1, scoliosis specific exercises, 2, custom bracing, and then 3, when needed, surgery. Now, scoliosis specific exercise is different than traditional physical therapy because what we do is we actually teach someone how to put their body in a correct position. And then once they're in a correct position, we actually have to strengthen and stabilize their body in a correct position. We'll strengthen and stabilize based on weaknesses that are found in a functional exam. So we want to strengthen the weaker areas. And then we want to teach the patient how do they hold their body in a more correct position while they're doing things they do in everyday life, such as walking or just standing and brushing their teeth or cooking. So you want to incorporate that into someone's lifestyle as well. In adults, pretty much when we get past our early to mid 30s, we start to lose some muscle mass every year. And in adults, what happens is we get deconditioning where they just physically can't hold themselves upright. So scoliosis specific rehabilitation is a great way to increase strength and stability and actually rehabilitate someone that is starting to break down and collapse so they can actually hold their body in an upright position. It's really key to be able to allow someone to just do the things they want to be able to do as long as possible. Now, when curves get more severe, or if there's instabilities where there's lateral prosthesis or a vertebrae starting to slip off, then you need some kind of scaffolding. That can be done with rods in the inside, like through surgery, or that can be done with custom bracing. But for bracing to be effective, they really have to be custom made for each patient because there can be, tons of different scenarios, and a one-size-fits-all approach will not be effective. So you need to do a custom brace that will actually hold someone, ideally, in more alignment or in balance where they're not leaning forward or they're not leaning to the side as much, but it actually holds them up and supports them and keeps them from collapsing. And we know if adults just wear braces 4 to 6 hours a day, that has been shown highly effective in reducing the progression of curves and sometimes even reducing the size of curves. And then the last thing, when all conservative methods have failed, that's when someone can potentially consider doing surgery. Or if the curves are just too severe to treat with bracing or exercise. And we do have parameters we look for to know when someone's got beyond conservative measures. The thing to consider though, as an adult, if someone has, decreased bone mineral density, like with osteoporosis, a lot of times they're not as good a candidate to start screwing in metal screws into the vertebrae. Also, as we age, we have an increased risk of, morbidity and mortality with surgery. So we know the risk of something going wrong, even like infections, goes up with age. So if you're having an adult with scoliosis, there's a lot of things to consider. The first thing you got to do is you got to get a proper evaluation so you can get your scoliosis evaluated. You can get it measured properly and also determine the likelihood of that curve continuing to progress. You also need to look for any other things that could be going on as far as any neurological problems that could be presenting as a result of the scoliosis or even contributing to the scoliosis. You got to determine a baseline of where someone is functionality so we see if we actually need to rehabilitate or try to regain loss of function. And then you got to determine the best treatment. Generally speaking, for adults, there's scoliosis specific exercises and there's custom bracing. Both of those have been found effective in treating adults with scoliosis, but the research is really clear when those are done together, then treatments are most effective. And the last possible option is surgery when indicated, but we typically don't recommend surgery unless all conservative methods have failed or the curve is just too severe to expect a potential positive outcome with non-surgical treatments. Thanks for watching, and I hope you found this information information helpful. And if you'd like to know about other topics on scoliosis or hyperkyphosis, just put that in the comments below. And finally, subscribe. Make sure you hit that bell icon so you can be notified when we publish new content. Now, if you or someone you know has been diagnosed with scoliosis or hyperkyphosis, you can request a free discovery call by clicking on the link below in the description. And this way you can find out what the best treatment options are for you.